Hello, everyone, and welcome to the Health Go Live webinar series. Today's episode is brought to you by our friends at Lineate. Just a few housekeeping items to go over. We would like to remind everyone that the Q&A feature will be available, so feel free to send in those questions for the panelists throughout the discussion. And afterwards, get your happy hour on with master mixologist Natasha Soto-Albers, as she will be creating a delicious cocktail and mocktail. And with that, I'll throw it over to our moderator who joins us from Lineate, Jessica Nissenbaum.
Thank you so much. And doesn't that sound wonderful? Definitely stick around for that if you have time. So I am absolutely thrilled to be here today. I am extremely passionate about this topic. I joined the healthcare technology industry over 20 years ago with a basic belief that we can do better. And I continue to hold that belief today and have been, really fortunate to be working on, helping that end and, solving issues in the healthcare industry that lead to better clinical and financial outcomes. And so I feel very fortunate to be at Lineate. We're a company that's passionate and committed to helping our partners and our customers solve challenges. We are very focused on data interoperability. We have a really deep and rich experience base in this area. We are the healthcare data interoperability solutions experts. And so this is a topic that we all care very deeply about. We're also really exceptionally human-centric company. And so because our mission is building connections for a healthier world, the data interoperability is the root of what we do and how we solve challenges for our customers and for the industry. So I'm so thrilled to be here. I love this topic. It's something that I'm really passionate about. And I'm even more excited to be here with some panelists that are doing amazing work for some amazing companies with some really cool stuff happening. So really, there's a lot to talk about. An hour really is not enough time to do this topic any justice whatsoever. So this is really just an opportunity to get the conversation started. And all of our panelists and I welcome you to continue the conversation and reach out to us if you have other things you want to talk about. We're all very accessible, and I think you'll find us pretty approachable. So, feel free to reach out after this session is over and, keep the conversation going. There's quite a lot that we can be doing in this industry together. So, I think let's just get started. So I'd love to introduce our panelists and give them an opportunity to tell us a little bit about themselves and what their organizations are focused on, and then we'll dive right into the topic at hand. So Andrew, let's start with you. What's going on over at Tigerconnect?
Sure. Hi, everyone. My name is Andrew Cordell. I'm the Director of Enterprise Accounts at Tigerconnect. Tigerconnect is a clinical communication and collaboration platform. So our focus is on connecting patients, caregivers, doctors, nurses together to allow them to securely communicate, whether that's text, voice, or video. In a previous life, I did work over at Rhapsody, so I have a lot of experience on the integration space as well, and here to lend a hand at how the two things interact.
Awesome. Anna, what's going on over at Arcadia?
Hey, Jessica. Anna Basovich, VP of Customer Success at Arcadia. For folks who aren't familiar with us, we work with clients to help them succeed in value-based care. We do that by assembling comprehensive data sets and presenting the resulting information in two places. One is analytics that help organizational leaders understand their performance and define interventions. And the other is workflow tools that are designed to enable care teams to act on those opportunities and maximize their time with the patients.
Awesome, really cool. Jason, you want to talk about patient ping?
Absolutely, thank you, and good afternoon to everybody. We're 4 o'clock, so good afternoon, everybody, except to my friends in Hawaii, in which case, mahalo and good morning. So my name is Jitin Asnani. I'm head of partnerships at Patient Ping. Patient Ping, for those who don't know, connects providers to seamlessly coordinate care, and we enable that mission by doing two things, really. We have created a network of real-time notification capabilities across the country. We're in 28 states and counting. In fact, I think we may have added a state or two to just today. So we are growing rapidly our network across the country, and have created a national network in support of coordination of care. And on top of that, we enable, we provide a set of workflow tools that allows recipients of those notifications to be able to sort through what's important, what's not, and be able to actually take actions to enable them, again, in support of coordination of care and taking the best care they can of the patients that they manage. And so really excited to have this discussion today and talk about how the work we're doing intersects with our partners and how it enables interoperability to continue pervading across the landscape.
Awesome. Welcome. Jim, you want to talk about what's going on over at BioIntelliSense? Oh, Jim, you're muted. I wonder how many times we'll say that today. Should we?
All right, just once. So thanks, Jessica. My name is Jim Malt. I'm the founder and CEO of a company called BioIntelliSense. I'm a cardiothoracic surgeon by training. Have had a few gigs along the way as the chief medical officer of Microsoft's first healthcare division back 14 years ago in the creation of HealthVault. And then along the way was the chief medical officer of Qualcomm. And so with BioIntelliSense, it's really the grand finale of a 20-year effort to really try to find a solution for making remote patient monitoring something that is ubiquitous. Literally, we take great care of patients in a hospital with all this data from bedside monitors, and then we send people home and have no information. And so we wanted to solve that problem. It started by creating a first of its kind medical device wearable. That's an FDA cleared multi-parameter vital signs monitor, as simple as putting on a sticker that can now monitor continuous vital signs and about 20 other parameters for 30 days on a single sticker. And that creates now a lot of data from a lot of people outside of the hospital. And this really opens the entire new conundrum of a mass amount of information that needs to be routed to the proper place for clinicians, and literally the explosion in virtual care that we've experienced because of COVID now also begs the greater need of making sure that data is ending up into the right place, in the right hands of the people that need to take care of you. So we're a data service. At the end of the day, it's really all about being able to deliver rich, new, insightful data to clinicians from patients outside of the hospital setting. And this is a really important topic to start understanding, what are the appropriate and most facile and economical ways of getting that data to the right place in a safe and secure manner.
Absolutely. I mean, just the volume, the sheer volume of data that we now see flowing through, both consumer generated and through the payers, the providers, and the need for that data to be actionable and accurate and transmitted safely. I mean, there's just, the need is massive. And so each of you are working on a use case that, or use cases that are so critical to solving some of the biggest challenges that we have in healthcare today and that we've had for years. So we'll talk a lot about kind of, where we are as an industry and where we want to go. But I think I want to start with sort of a non-traditional moderator approach and maybe ask a selfish question. My role is Chief People Officer, so a lot of what I do is focused on, connecting people to the challenge that we're trying to solve. And so what I would love to hear from each of you, just to get to know you a little bit better, is why are you here? What is the purpose and the why, the passion that you have about healthcare specifically? What gets you excited about the challenges that you're trying to solve? Just a little bit about, sort of what brings you here and what gets you excited. Andrew, I'm going to pick on you first.
Sure. The excitement, I think, is just surrounding the pivot into bringing the patient more into their own care. I mean, I think everyone here has mentioned some sort of technology or focus on that. And integration, to me, historically meant keeping systems in sync so that care could be provided by someone else. And now, to me, it means allowing a patient to manage their own care, allowing a patient to participate more actively in their own care. So the idea that integration is getting simple or streamlined with new protocols or new standards is is really not true. It's getting more complicated and more complex in a good way, though. It's enabling people, I think, to have that capability that they couldn't have before when things were on paper or just not quite accessible. So the excitement there is me. I've always wanted this myself as a consumer of healthcare. And it's exciting to see how data plays a part in this, but also just the innovation that's coming out, especially during COVID. I think the technologies or the companies that were ready to be nimble are going to come out the other side 10 years ahead of where they thought they would have been, you know, in 2021.
Yeah, I mean, you're definitely speaking to what's near and dear to my heart, right? So putting the patient and the consumer at the center and the heart of what we're doing as an industry, I think shifts the focus, right? It gives us all an opportunity to really empower the individual to take, you know, some further steps and have more of an active role in creating more value for themselves. You know, we can't control a lot of the financial realities of our healthcare system, although we all are playing a part in trying to do that. The reality is we have to find more value, and the way to do that is through the data. And so as a consumer, if we have more access to it, if we can, or if our providers can add more value to it, we are really taking steps in the right direction to make it a more meaningful experience for everybody. And there's just so much more consumer generated health data that we all should want to see more value added to. And it's just an exciting time. So I hear you and I agree completely. Anna, looks like maybe you have something you'd like to say.
Yeah, Jessica, I totally agree. And right now in particular is such an interesting time to be here, because what stands out to me is just the vast opportunity for us to impact the level of care that people receive. And it's something that's so critical, and we're so well positioned from the technology point to deliver those changes at scale. So one of my favorite parts of working for an analytics company right now is that we actually get to measure the impact of the really good work that our customers are doing, and we get to see that pay off. And that's incredibly rewarding.
Very cool. Jitin.
You know, the reason I used to be in a different industry for the first half of my career. I was totally an e-commerce and fintech guy, and then I came into this industry about 10-ish years ago, so a little less than half my career ago. And a large part of the reason I came in is I had friends who got seriously sick and had to go through the healthcare system as it stood 10 years ago. And it was amazing to me. Some of these folks, like one of this person in particular that comes to mind, she was like a titan in the e-commerce industry, a CEO at one of the companies we've all heard of down in Silicon Valley. And she had a miserable time. She felt so disempowered going through that process. And so a large part of the reason I got into healthcare was, and particularly this health IT and interoperability landscape, is the potential for empowerment. And it's at that individual level, to Andrew's point and Jessica, your point as well, but also for the provider. I'm married to a physician, and day in and day out, I get at least a sense, if not actual PHI, thankfully, but actual sense of the things that she has to deal with and the decisions she has to make in the care of patients when she doesn't have the right information, the right time, the right place, the types of information she need to actually make the best care. So I'm looking at her trying to be the best doctor she can from an Ivy League trade school, and she doesn't feel empowered to take the best care of the patient she can because she doesn't have access to what she needs. And so kind of looking at it from those two frame points, I think there's a tremendous amount of empowerment, about human empowerment, that comes out of this really otherwise very kind of dorky propeller wheel topic around interoperability. And but it's really what drives kind of my passion in this area.
Awesome. And I think, you know, it's a really good point, right? Because we're kind of a slow industry. I don't think it's a spoiler alert that healthcare moves slowly. And, you know, to still hear that story and realize we've been at this for decades and we're still solving this problem and trying to make it better, I think we can do better as an industry, and data interoperability is at the heart of that, and really important to being able to really accelerate and drive that move forward. So thanks for sharing that. I think it's really important from the provider's perspective too. Jim, how about you? What gets you excited? Why are you passionate about this industry?
Oh, it's been a 20-year journey, but you know, it's funny. Healthcare moves slowly, and then suddenly it makes this exponential leap in literally 6 months' time. And you know, this pandemic has been a horrible thing for so many reasons. But having said that, many of us have been in the space trying to drive, virtual care, telehealth, remote patient monitoring for more than a decade. And, it's been very, very slow. And literally from March 1st until September 1st, you have an unending number of organizations who were dabbling in telehealth and remote patient monitoring, even in the last year. By example, institutions that were doing telehealth, maybe 4,000 telehealth visits in the course of an entire year, are now doing 400,000 telehealth visits in the last 6 months. So it is staggering, the sudden change. And a lot of our lives have changed forever. We're starting to learn we don't necessarily have to go to the office every day to get work done. And I think you're going to see life and kind of our societies change in a number of ways. And what we've just learned that many of us felt passionate about for decades or more is we can start to deliver healthcare, without dragging people to a clinic, to a hospital where there's lots of other sick people. If any of you have kids, how many times have you thought twice about taking your kid to the pediatrician because there's going to be a bunch of other sick kids in the waiting room? And now we're learning maybe it's actually just as good to have a telehealth visit come to my house. And it turns out probably 80% of primary care and pediatric care and psychiatric care can be delivered virtually and be delivered really effectively. And so, it's an exciting time that can change the cost curve. It can make it more convenient, better accessibility. And at the same time, it all comes back to, we got to make sure the data is in the right place to be able to do virtual care. Otherwise, I'm going to have to drag you into the clinic and take a look at you with my own hands and make my own measurements. So, this is it's literally a pivotal moment in the history of healthcare that we're going to look back on. In many ways, because of the pandemic, all these things are changing, but many of them, fortunately, will be for the good if we can get it right and sustain it.
Yeah, absolutely. I think, COVID's an interesting topic that we can definitely talk about as it relates to interoperability. I think another compelling event that happens often in the healthcare industry or that we've seen over the years is, a government regulation comes in and we see some movement and some traction build. So we can certainly talk about that a little bit. But, thank you for sharing your sort of purposes and whys and your excitement. Let's go back to sort of the why of interoperability though. So, what's so important about it? And maybe you can each talk a little bit about the sort of use cases that you need data interoperability to solve for your organization or for your customers, just to sort of dig deep a little bit on why interoperability is so important.
Sure, I could start with that one.
Sure, great.
So now being on the I guess the receiving end of data at Tigerconnect, it's a little bit of a different paradigm than I guess I was used to before. So Tigerconnect is a platform that allows people to communicate. There's a traditional sense of interoperability to enable it to work in that you could use integration as a way to elevate information from an existing system that you have. So whether it's an analytics platform that's uncovering something worth noting, or it's your EHR that's letting you know that a result is back. This sort of information is really effective when it's brought to your attention in real time. So that delivery mechanism of coordinating care across a team or to an ordering provider is super important in that it enables an action. A quicker response time can mean saving a life. It might also mean more revenue for the practice because they can see more patients. So there's that sort of integration. There's also kind of the more syncing integration that a lot of health systems are still dealing with, is just trying to, not do double entry, not have out of patient's information over here and over here not be the same. And so bringing in contextual information from a repository, like the patients you're going to see in the next week, that's probably a good set of people that you might want to touch base with, and therefore have that information flow across. So integration really enables at least Tigerconnect to do more than it can do out of the box. Out of the box, it allows everyone to communicate, which is super important. Just being able to text another physician securely is valuable in and of itself. But when you have information that can automatically come into context in a conversation, or you can bring in a patient into that conversation and text with them about a result that came back, that really catapults it to the next level. Because a lot of physicians don't spend time doing doctor things. There's a lot of time in a day of entering things in the EHR, calling and waiting on hold, playing phone tag, looking up something in one system to validate in another system, and all of these things are solvable problems. You don't go to medical school for half your life to play phone tag. So there's a lot that can be done with integration. I think the goal should always be to squeeze out all that wasted time to optimize all of the time doing what it is that you want to be doing, which is caring for patients.
Really critical use case, right? Improving quality of care and probably physician burnout too, right? There's a lot of issues that your organization is
that one's big.
solving challenges for.
Nothing more frustrating than not doing what you're supposed to be doing because you're waiting for something else.
Yeah, both are challenges, right? And equally important to solve. So that's a fantastic solution. Jiten, you have a sort of similar use case, I think, or a synergistic one. So maybe we go to you next.
Yeah. I'd say in many ways it's complementary. My perspective on interoperability is that we've been there are. If you think about what just regular data repositories looked like in the early 90s, right? We had tremendous amounts of data all around the world, tremendous amounts of information that could be utilized all around the world, and no decent way to connect it up. And then DARPA and CERN came along and they created this thing called what became the internet, right? So, and that was a very deliberate process of opening up. It was actually started out simply as opening up repositories, but since that time, look how far it's come, right? There's all sorts of services, utilities, things we use day in, day out, this video conferencing capability that we have right now, all built on this notion that just open up a repository, right? Very simple notion that turned into something much bigger because people are able to take steps in innovation. And that's, so from my perspective, sitting at a company like Patient Ping, we're enabling a set of services right now to enable providers, care providers to take care of patients, which our CEO is quite visionary. But if he had this vision 10 years earlier, he wouldn't really have been able to do much. There's no surprise that a lot of some of the neatest innovations have come post meaningful use stage 1 and 2, where interoperability started becoming a requirement in EHRs and in platforms and for providers ultimately, no matter what method they used for getting the data out there. And so in our use case, we have, our primary users are really providers of all sorts, but particularly those who have some stake in the game in bending the cost curve or improving care, or both. So, ACOs, primary care providers, post-acute providers, and payers and the like, all who have an opportunity to actually intervene in a positive way in the care of the patient, to direct them to be able to utilize resources and get the care they need, connect with coaches, etc., whatever it is they need, in order to reduce, in order to both reduce costs while enabling them to get the better care. And it's a service that completely depends on the notion of interoperability being fundamental in the first place. Because if you're not able to know where the patient's been, get their data at the right time, right place, in the right mechanism, served up in the way that they can use it, there is no such service. It's people running around just trying to follow your patient, which oddly enough is what we did 50 years ago, where your provider would literally come with you to the hospital and so on. And there was something certainly nice about that time. But then it never allowed you to do, specialization and all those other things, which created the data silos that we're trying to traverse today in creating interoperability. So we've sort of come full circle, but now the opportunity to do these things and to do them at scale across geographies, nations, across, actually, I don't know if we're doing across nations yet, that'd be cool, but across certainly geographies, patient populations, and the like, is what's tremendous about it. So that's kind of the value of interoperability and allowing us to do some of these use cases, not just the way we did them in quote unquote the good old days, but actually at scale across the country so that nobody is left behind.
Yeah.
I had a follow up to that actually,
Yeah,
Jitten. It sounds like your solution there is the network is the value, right? As the network grows, so does the value, probably exponentially, and that probably correlates on the data side and on the people side. And that the more people are participating, the more value there is, and the more data there is, it kind of snowballs. It's the same at Tigerconnect. I was kind of connecting things. You know, the more people that are securely able to communicate, the more valuable it is. And this network of networks concept applies both, yeah, as I already said, on both sides, on the data side with integration, and on the people side with actually taking the value out of the system to do something with it.
100%. It's definitely a very large part of the overall value, in addition to, being able to provide people with the workflows to be able to use that data in a meaningful way. That's the other side of interoperability. Data opens up, but then you have to use it in some way. Tigerconnect for its set of use cases, Patient Thing for its set of use cases, it figures these things out so that users can utilize that data as it opens up and gets exposed, but in ways that actually can be meaningfully utilized to improve patient care.
Yeah, probably, Anna, it's a good segue to you. Really aggregating the data and providing some level of insight and actionable value to it is right in your ballpark.
It's our focus, absolutely. And Jitten, what really stood out to me was your comment around no patient left behind. And for us, that's one of the most critical use cases for interoperability, is making sure that our clients have that really comprehensive data set so that they have their hands on all the information that they can get across their whole patient population. So when you're going in, if you're a health plan and you're stratifying patients to determine who needs to be in a complex care management program, who needs to have a coach or a nurse working with them directly on some care coordination items, lifestyle, nutrition, et cetera, it's making sure that they are using all of the data that can be available in order to pick out the right patients. And one of the things that we see is the more you expand that data set, the more you're able to really tune in some of those algorithms that can be used to identify patients most effectively, to make sure that the limited resources that an organization has to put towards working with patients are being allocated where they can make the most difference.
Yeah, some really interesting similar themes across all these organizations, and I'm eager for Jim to weigh in because a lot of your organization is tied to these same things of accuracy and reliability and analytics and services. So all very similar themes across the data interoperability spectrum for healthcare. So tell us about the use cases that your organization is solving.
Yeah, well, with BioIntelliSense, we're now creating or generating very significant medically critical information from people out of their homes. And in fact, during COVID, we've all seen the surge and the overcapacity of hospitals not having beds to be able to admit patients. And so they've been able to use our BioSticker as a basis of sending them home and then monitoring them in their home. And so you have what are called hospital at home programs now that have been standing up nationwide, literally for nothing other than overflow capacity capabilities. So, you're talking about taking care of pretty sick people who probably in many cases should have been in the hospital, but we just didn't have enough beds to take care of them. So now that data is coming up, wirelessly up into our cloud. And then, we've had the need to be able to integrate very rapidly into now almost 36 different downstream electronic medical record systems, remote patient monitoring vendors, large payer organizations, and frankly, that's a lot of plumbing. And if you don't get that plumbing right, now you're in a situation where people could literally die if we're not able to execute that very quickly. And to Lineate's credit, they've made this so easy. And the integration efforts have been, so I would say, flawless. and almost effortless, where we've had third-party systems connected to our data stream and our analytics engine, because we're able to watch, we're generating 1,440 temperature measurements per 24 hours, and the same number of heart rates and respiratory rates from somebody at home. And so that's, again, it's a rich amount of data. We're doing analytics and sending alerts and notifications, and so the reliability of these systems and the connections and the plumbing are critical in nature. And it's those types of circumstances are just going to continue to grow as we start to deliver more and more care into the home.
Mm-hmm. Yeah, absolutely. And I think, the volume of data, as you talk about growing, it's just exponential at this point, both for, in-home care and the monitoring that we need continuously there to support certain populations, but just the ongoing sort of general practice stuff as well. So it's just a massive amount of data. And I agree, if the pipes aren't built or constructed properly and that data isn't flowing to the right place at the right time, it's useless, right? So we really need to do it right and get it right, and that is what Lineate is, does each and every day. That's our expertise. So thank you for that compliment.
Well deserved.
And a lot of passionate people behind it who care very much about that exact thing. So it is our central way of being. But let's go back to COVID a little bit. I am interested in sort of the impact of COVID, not only to the industry, and I don't think we know all the implications of COVID to the healthcare industry, and I don't know that we'll know that for quite a while, but for your organizations and kind of what you've gone through in the COVID time, has your company pivoted at all, either in terms of product development or the solutions that you provide to customers? And we've talked a little bit about this. And then operationally, sort of, how have you had to, sort of adjust your day-to-day operations to be able to support your customers the same during this time period?
I can hop in there, Jessica. It's definitely been a change for us, and we've done a fair amount of refocusing. We pivoted on it pretty quickly, and actually a recent example here is going to be a really nice one. As we've been observing, and as many customers have been observing, and I think nationally, we've been seeing a really concerning drop in childhood immunizations that's really brought to the forefront how much critical preventative care has been deferred for the past 6 months, and the fact that realistically we probably expect that to continue for some time. So we've been offering our outreach tools across our customer base at no charge to help customers re-engage their patients, make sure that they have a good understanding around the options that are available to them in terms of care, that they're able to get patients in for telehealth visits, or let them know when clinics are reopening, so that some of those relationships with the primary care office and with specialists, when that's appropriate, can really get reestablished and stood back up, and we can start to catch up on this. There's a couple of other things that we've done as well around patient stratification. So early, even back in March, we were working with our customers to help them identify the patients that were at greatest risk for COVID complications, to ensure that, again, they could have care managers reaching out, they could be getting the right educational resources out. We felt that it was critical that folks whose health could be in danger weren't learning about this disease from Twitter, or weren't kind of getting the gamble of, depending on what channel you turn on TV, could make or break whether you're getting the right information. So for us, equipping our customers to communicate really credible information to their patients was absolutely critical.
That's amazing. Very, very awesome pivots. It's nice to see organizations be able to move quickly when crisis happens, and to be able to do it for customers in a way that's really meaningful. So congratulations to you and the team for being able to do that so fast.
I'll add to that. What's amazing with this crisis from the perspective of the response from participants across the industry is in some cases the complete pivot to doing something entirely new. And sometimes it's all about the speed with which something got accomplished in support of the larger goal of improving public health that we clearly has come into the limelight because of the crisis. In terms of what we did at Patient Think, for example, I wouldn't say that we made a tremendous pivot in our business kind of strategy, product base, and all of that. But our users depend on us to be able to sort through the data that's coming from out there and help them figure out which patients do they need to act upon to be able to give them the right care and the right sort of follow-up. And because of this crisis, we, very quickly in a handful of weeks, enacted something which we internally and I think externally also call it the COVID flag, which basically meant that we highlighted those patients who across the network have received diagnoses that are associated with COVID. And if you think about a large section of a network are organizations who are either affiliated with health systems, or they're skilled nursing facilities and home health facilities and other places where patients who are particularly at risk are entering on a daily basis. So if we can just, in a product that they're already using, give them a little bit of additional heads up that they may want to be careful before this discharged patient who has COVID symptoms enters your skilled nursing facility. Tremendously valuable, not a particularly dramatic shift in sort of product or business, but tremendously valuable and very much in support of our public health goals. And that's, I can't imagine that no company has had to kind of think through what it is they can do to help. And that's where we stepped up.
Jessica, another area that's changed overnight that we've been involved with is the area of clinical trials. And because of COVID, obviously a lot of clinical research at academic medical centers, as well as pharmaceutical research, drug development, came to a sudden screeching halt because you could no longer bring people in for a research study in order to take measurements and so forth. And so literally, just like telehealth, there's now an explosion in the category of virtual clinical trials. In fact, as a plug, I'm the chairman of a new working group in the American Telemedicine Association, specifically focused on virtual clinical trials. And you're seeing all the CROs, all the pharmaceutical industry, and frankly, the FDA and regulators recognizing, wow, actually, we could probably recruit more patients and have bigger studies at a lower cost, have better data, and we'll be able to answer scientific and medical questions faster by being able to pool data. I mean, all of these really powerful things that we know were possible, but it took a forcing function like COVID to kind of drive that into immediate practice. And once again, I think heretofore forever changed, for the better.
Yeah, to your point, it often takes a compelling event, right, to get us kind of refocused or looking at it with a different perspective. And certainly COVID has done that for all of us in our internal operations and our, sort of disaster recovery practices, et cetera. But that's a really important example. And I'm glad you brought it up because it's a meaningful one. And it illustrates something that we all should be thinking about and are thinking about in COVID, which is, let's look at this positively. How do we create, more value and accelerate some of what we already knew or already were planning to do, but just by looking at it from a different perspective and taking advantage of the environment that the situation has created for us. So really powerful example. Thank you for sharing that. Andy, your thoughts?
Yeah, I was going to comment on something. I think Anna said it about the amount of information flowing around and where to find, updates. And Tigerconnect, I think, was uniquely positioned as a communication network before the pandemic. We have about 6,000 customers using Tigerconnect for their own communication efforts, which allowed us to create this network of networks. And we launched what we called the COVID-19 Physician Forum, which effectively you can think of it like a Twitter or online forum, but a secure one that you have to be a physician, you have to have medical credentials to get access to. There was no charge to join it. And the goal was to just have physicians collaborating across the country about information in real time. And so the thought here was, hey, we have this capability. We never really anticipated needing to do something like this, but let's just launch it. And that's kind of the approach we took. And it just grew over time organically with people kind of word of mouth spreading the news. We didn't really do a big press release around this. It was organic growth. On top of that, it kind of like Jitin said, we didn't pivot necessarily the business model. We just happened to be uniquely positioned to be providing something that everyone needed. I kind of more highlighted how important communication is when you're not physically next to each other. So, and for our business, it actually, the growth exploded as everyone went remote. They needed tools to communicate, and they needed to do it with themselves and with patients. And so this right place at the wrong time, I guess, maybe a right place at the right time kind of, yeah, wrong reason, but right place, I guess, showcased why communication is so important. And yeah, being able to connect out to patients. What we did is we redid our whole roadmap. We had been focused on other parts of the communication and collaboration spectrum, I guess, and went right to patient, right? We need to be able to interact with patients virtually over text, voice, and video, and that enabled providers, whether you're a primary practice with 4 people, that needs to connect with your patients remotely, or have them wait in the parking lot before they come in. I think I heard someone mention that. So they're not sitting in a waiting room together, getting each other sick. It's broadened the use cases that we hadn't even expected to see. So yeah, it's been an interesting ride for sure.
Yeah, it's also meaningful. And I look at these organizations, each of the companies that you are focused with, and there's a lot of similarities in the values too. And I just think about, Lineate's values and how we focus on our customers and our customers' customers, and to the degree that each of you are doing that similar. It's just, it's so wonderful to see all the synergy that exists between these companies and all the value that we can bring to our customers. And sometimes those subtle shifts in a roadmap can make all the difference to our customers and to their customers. And so it's really impactful, and it's very cool. Let's talk about another sort of compelling event that happens. So we talked a little bit, or I touched on it earlier, in terms of the ONC and the CMS rulings. Often the government will step in and put some teeth behind a regulation to help accelerate the focus of something in the healthcare industry. And we've seen the results of that over time. Sometimes it's slow to adopt, or sometimes we put solutions out there before they're fully baked, and we don't really actually solve the problem that we intended to solve, and then we have more government regulation come in to sort of look at that. So I'm curious how each of your companies are maybe solving or helping to solve for what's going on with the ONC and the CMS rulings, and what the spirit of them and what the intention of them is intended to drive forward in the healthcare ecosystem.
I'm happy to take a stab this time to get us rolling on it.
Sure.
So for those who are not familiar, those ONC and CMS rules, they encompass quite a lot of surface area. So I would imagine there's a wide variety of participants across the HIT vendor and technology spectrum that has some role to play in it. And the provider organizations themselves, who are on the hook, have not only technology decisions to make, but so many policy decisions to make to figure out how to comply with the rules. And just for reference, we're talking about, I think, primarily 2 sets of rules: the ONC information blocking rule, and and the exceptions you must meet in order to not be called an information blocker if you don't share information for some reason, or rather share patient information in the right context for some reason. And then there's the CMS interoperability and patient access rule, and that had a number of different components around patient and provider access in it as well. Our role as patient ping has been specifically targeted on one of the requirements of the CMS patient access and interoperability rule, and it's specifically around this thing called conditions of participation that requires hospitals and health systems, hospitals of all sorts actually, they really called out a comprehensive list of different types of hospitals of all sorts, to be able to send notifications for admits, discharges, transfers, ED presentations, and the like inside their hospital to providers who are downstream providers who are caring for that patient, regardless of whether the patient declares that, here are my providers who take care of me, or whether the providers declare that here are the patients I'm responsible for taking care of. So it has created this, in some sense, it's created this requirement. In fact, in a real sense, it's created a requirement for hospitals who are not already doing this to start doing this. But it's also created this tremendous opportunity for participants across the network, across the industry, to be able to get the information they need to take better care of patients. Because this is, again, real-time event notification information that's now going to be required of all hospitals and health systems to share. To that end, what we're doing specifically, and maybe this was the big sort of, to your point, paradigm shift or fundamental shift for us as a company, as opposed to the really quick incremental steps we made in support of COVID, for example. For us, what we realized was this is a space where you're tackling requirements on sharing this type of real-time information from providers of a variety of different sorts, primary care, post-acute, and so on, where we just have a lot of experience. We've been doing this day in, day out for the last 7 years. We're coming up on our 7th birthday later this week, actually. And thank you on behalf of the company. And so what we did was we realized it was time for us to be able to help out. So we have a product called Route that's out there in the market right now. Its job is to enable health systems and hospitals to be compliant with the rule, to enable any provider who is being able to, who has a patient's attribution relationship with the patients coming to that hospital, to be able to get requests and get notifications on those patients. And whether or not they're part of our network, we ensure that those providers receive the notifications. And the beauty of, particularly in the co-creation lab where we got to participate with Lineate, is that one of the fundamental capabilities you need is to be able to share your data, and particularly ADTs, to be able to enable Route to do what it does on your behalf. The software, the services, et cetera, we do on behalf of the provider. The linchpin is the technical integration, and that's what is the beauty of kind of what Lineate is doing in enabling partners of all the sorts here on the screen to be able to actually seamlessly exchange data into and out of the platform. Zooming out, this is part of obviously a bigger tapestry of regulation that's kind of pushing all data to be available to all providers and others across the ecosystem, and so that's tremendously exciting. And I'm really excited for the role that we have to play and that we get to play in enabling one of those streams of data to move around more fluidly.
Yeah, I'm excited about the rulings too, because I do think they have more teeth than I've seen in the past for some of these regulations. So I think there's a more likely step forward faster, and it will be a catalyst for real change and the kind of change that we've been needing for a long time. So exactly what you describe, I'm pretty excited too. And I think the products that your organization is offering are right there, right? So it is a cool time to be in this industry solving these problems. And so Jim, I think you were ready to hop in. I didn't mean to cut you off.
Oh, no, I think, obviously in our world, a lot of things opened up very quickly from the FDA's approach, and again, making it possible to fast track certain device programs. Literally in response to COVID, we fast tracked the development of a little tiny button to monitor temperature, heart rate, respiratory rate, actually not for sick people, but we had entire universities and huge 100,000 employer groups all wanting to be able to monitor frontline workers and back to school, back to work. And so we went to the FDA and said, we need to do this fast in order to help a lot of people, and literally got overnight clearance because we already had FDA clearance on our initial device. But I think you're seeing, the right thing happening, which is people coming together, trying to figure out things, reduce bureaucracy, reduce barriers, and try to solve problems quickly that we just haven't faced as a society for a century or ever. Now the key is, how do you sustain the good decisions and don't have things kind of fall back to historical practice. And I've been invited to give congressional testimony and different meetings with both Senate and House staff in my role at the Consumer Technology Association, and it's been interesting conversations about making some of these decisions permanent. And like with telehealth and reducing interstate barriers to licensure, as an example. And so I think we're going to have to work very hard to make sure that some of these things that have been accomplished under emergency use authorization and the public health emergency, you know, stay in place for the right reasons, and because it's easy to kind of behavior to say, oh, we made the decisions, you know, without enough due diligence. Let's reverse it to what it was and think about it some more. So I think we need to be very proactive and figure out what are the key things that change that should stay, and have strong arguments for keeping them that way.
Yeah, really, really good points. Let's talk about interoperability sort of in the more traditional sense of the EHR, right? So it was always sort of a discussion about connecting disparate systems within the healthcare system, but healthcare IT vendors think about it a little bit differently in terms of, you know, where that data needs to go outside of the healthcare system. So I'm curious, you know, from each of you, sort of what are your thoughts on interoperability really extending beyond the EHR? And I see that there are some questions in the chat that are sort of related. So I think it's an important topic for people to think about, you know, extending interoperability beyond the sort of traditional sense of EHR, EMR. Go ahead, Jim.
Yeah, so this one is very much kind of a day-to-day challenge for us, frankly, because, you know, interoperability is hard enough. But now, for the first time ever, we're generating, you know, data from this that's never been generated before, like coughing frequency. So, you know, it's really exciting for clinical medicine to be able to see, you know, somebody developing COVID or pneumonia, you know, their fever's going up, their heart rate's going up, but we're actually able to count each and every time they're coughing. And we can show you their body position, if they're on their right side, their left side, they're supine or prone. And we're generating this data, but we have no place for it to go because there's not even a discrete data type. And so all the EMR vendors, everybody's like, the clinicians are so excited about being able to have this data to take better care of patients, but I've got no place to put it. I have no place to be able to visualize it. And that's going to just happen more and more with genomics and proteomics. And so, you know, and you can't wait for 10 years for somebody to sanction, you know, an official data type in the HL7 table. You know, so how do we deal with all the new data types and be able to do that smarter and faster? So that's kind of a different interoperability concern.
Yeah.
But it's going to hold us back.
Well, it's from a variety of angles, right? There's that frustration. There's frustration from the consumer. I mean, we're collecting all this data ourselves, and we want clinical value to be added to it to improve or understand our own clinical situation or those of our loved ones. And we have all the data, we have access to the data, but if it's not available to the providers or to the right folks to add clinical value to it, what good is it? And so the frustration is building on all sides, right? And so, you know, this is a problem that we have to solve. There's no question. And I'm so thankful to everyone on this panel for attacking it from different angles and thinking about it from different approaches, because it's just so critical. And this pent-up frustration is building and building and building for everyone. Literally, providers, the payers, you know, patients, you know, pharma, everyone has a similar need, a similar frustration. And so what I love about that is that it's creating change, right? It has to come. We're at that point where we must do. Andrew, I'm curious about sort of the Tigerconnect view on this topic.
Yeah, that's a good question. For us, it's not so much about the EHR necessarily, although that happens to be where a lot of actionable data comes from for users of Tigerconnect, just because the repository, the medical record is often a place where we're able to create an actionable event to notify someone. But our thought process around really everything we do, whether it's communication or integration, is go to where it's most useful. It shouldn't be like I think James just said, tied to necessarily just HL7. That's a great source. It has a lot of useful information, but you can get so much more from other locations that might be even more useful. And then there's kind of the thought that a lot of people kind of, at least from my perspective before I got into healthcare from this space, was that medicine was black and white. In other words, you know, what are your symptoms? Oh, you have this. Like, it's kind of like almost like an algorithm that people like doctors are like, oh, you have this. And so much of it is guesswork and intuition and reading between the lines and using the information that you have at that time. So information is great and it adds to that, but so does the ability to bounce ideas off of each other and capture things that are more or less discrete, especially when you get into behavioral health or mental health. Those are obvious examples, but even just, you know, any sort of other health is, you know, how did the patient feel that day? You know, that's a little harder to capture and maybe mine the data for, but still super relevant to providing care. And so I think it's important to sometimes take a step back and say the data is, you know, very important, but so is the ability to look at it as a collective mind and decide what to do with it. Yeah. So we always try to use integration in the right way. Since we're not a system that's keeping records of anything, we're not so concerned about, we're probably the opposite of Anna. Anna wants as much data as possible. Give it all to Anna and she'll make magic out of it. We're kind of the opposite. We only want really important data because physician fatigue or over alerting is a real thing. And bombarding someone with 1 million points of data doesn't help them do anything unless it has meaning. So it probably needs to be funneled through something like an analytics platform to be boiled down to actionable items or relevant topics at that time, and then delivered via some secure means like Tigerconnect to do something with it. So yeah, our version of interoperability sometimes is different, is less is more, actually.
Andrew, it's completely true, and we're thrilled about the data volumes that we get to work with. Mm-hmm. But so much of our job is focused on repackaging that data and focusing it to the right use case. And that's one of the things that we always talk about is a care manager is going to come at the same data very differently from an administrator, from the provider that's actually getting to see the patient. And I mean, when I'm in with my PCP, I feel like I get, you know, 5 to 8 minutes out of him, maybe. So it's so important to make sure that when we're pushing these huge volumes of data out in front of providers, and you're so right to call out that alert fatigue, where we hear from our customers so frequently, you know, my provider's got another alert, so they clicked cancel, 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 and who knows what happened with that information. So it's just so critical for us to be very thoughtful about the use case, about the perspective of our user, in making sure that we're putting forward the most critical data at exactly the right time, so we know that it can be acted on, which is the most important part.
Absolutely. Well said. And I feel like that's exactly the right note to end on, because it sort of, you know, gets to the heart of exactly the topic at hand. And so I'm mindful of time. I see we only have a few minutes left. There are some questions in the Q&A. What I'd like to do is commit to the audience that I will work with our subject matter experts here on the panel to get answers to all those questions. And Lydia will help drive out some of the responses and make sure that we address all the topics that you know, are of relevant to the audience. I would say don't hesitate, audience, to reach out to these people directly as well. So if you've heard something of interest to you, you know, feel free. I'm sure they're all really excited to have you reach out on LinkedIn or elsewhere to connect more on this topic. It's a meaningful topic. It's an important topic. It's something that we all should care about because it touches all of us in each of our lives. So I would strongly encourage the dialogue to continue. But with that, I think we'll wrap this session up. Thank you so much, panelists. I'm just so excited about the work that your organizations are doing, and I love talking with smart and passionate people, of which you all are. And so thank you. I really appreciate the time. And on behalf of Lineate, thank you for what you're doing and for supporting our product.
Our pleasure. Thanks, Jessica. Thanks, everybody.
Thanks for hosting.
Thank you, Jessica, and to all of our panelists. If you'd like to continue the conversation, please join us on Twitter. And now, please welcome our master mixologist, Natasha.
Hi, everyone. Welcome. I'm so happy to have you join me for happy hour today. My name is Natasha Soto-Alborz. I am a New York City-based mixologist, most recently at Motel Morris Restaurant in Chelsea. I've also bartended on the rooftop of the Gramercy Park Hotel. So today I'm showing you one cocktail and one zero-proof cocktail, fancy way of saying mocktail. And I'm using lots of summery, very seasonal ingredients. I think this is an awesome time of year to incorporate a lot of things from the garden, fresh fruit, fresh herbs. So you're gonna see I'm using some fresh basil, some peaches, some serrano chili. The world is our oyster right now. We have great produce and it definitely should make its way into cocktails. So my first cocktail is a really fun spin on a classic. The classic cocktail is called a brown derby, and it comes from the Prohibition era of cocktails. It is very simple. At its heart, bourbon, grapefruit juice, and honey syrup. My little spin on it today, I'm adding in fresh basil, and then I'm also adding in a sugar and salt rim on my glass, which I'll show you a little bit more about in a moment. But that's how I'm making that cocktail my own. A little history on the Brown Derby for those who don't know. It was a restaurant in Hollywood, actually, at the height of the golden age of movies. So think like 1940s, 1950s. And the restaurant itself was actually shaped like a derby hat that men would wear in that time period. So that's a fun fact. It was a very unique looking restaurant, frequented by lots of Hollywood stars, and that's where the cocktail gets its name. So we'll jump right into it. I want to talk about honey syrup a little bit. I think it's fun to look for alternate sweeteners for cocktails. We all get a little bored when everything has simple syrup in it, right? Not the most interesting choice always. So I've used some really great wildflower honey, and I've made a syrup with it. And the point of making a syrup is to dilute the sweetness just a little bit so it's not quite so cloying and intense. And also it makes it easier to shake in a cocktail because, as you know, obviously the consistency of honey is not really going to shake too well with bourbon and your other ingredients. So you want to dilute it. The way you do that, equal parts honey to hot water, whisk it, or you can use a fork or a spoon. Just make sure you're stirring it very well while it's warm. And you're going to get that perfect kind of liquidy consistency that we need for a drink. So proportions. Oh, and also I'm calling my version of this Hollywood and Vine. That's an intersection in Los Angeles. There were multiple Brown Derby restaurants. That was where one location was. So I thought that was a fun way to pay homage to that. So to get us started, I'm using 4 Roses bourbon. I'm going to do 2 ounces of that right into my shaker. And then I've done fresh grapefruit juice. If you can squeeze it fresh, awesome. If you need to buy it at the store, I'm not going to judge. Whatever you need to do, keep it simple for yourself. Doing a whole ounce of grapefruit. It's a really herbaceous, refreshing cocktail. And then for my honey syrup, I'm doing a ½ ounce. It's totally up to you. If you're a person that likes sweet cocktails, again, totally fine. You can up your honey content. If you're like, absolutely not, I don't want too much sugar in there, then just cut back. Fresh basil. I'm going to just peel 4 leaves right off of the top of the stem. Throw it right in. My last ingredient is Angostura Bitters. It does exactly what the name says. It's adding a bitter base note to the cocktail, balancing out all those flavors in a really great way. 3 dashes of that. And then I'm going to add my ice. Get my lid on my shaker and shake it really vigorously. It's not just for show, it's to actually get it well mixed. Yes, you have to put some muscle into it. It's a good workout. Whenever we're shaking cocktails, we are looking for dilution. We're also looking for a little bit of, obviously we're chilling as much as we can, but dilution is our friend because the flavor of bourbon is pretty intense. We actually want to mellow it out a little bit when we're adding in ice. So then my strainer's built right in, but I'm going to use a mesh strainer to kind of get a double strain going here. And it goes right into my coupe. This is a large glass, so don't let the size of the glass fool you. It is a large drink, but it's an even bigger glass today. Just really pretty, and I really like the way it looked. So what you're doing when you use the both strainers, you're getting those little bits of basil out of there. While it tastes great, I actually want the flavor. I don't really want the little chunks of basil to make their way into my drink. So now I have it in my coupe, and again, I told you on the rim, I did half salt and half sugar. I mix that together just in equal parts. I put it on a little plate. I use a little bit of citrus juice, just around half the rim of the glass, and then spin the glass onto the salt and sugar mix. I did it in advance to save a little time, but it's not a terribly difficult technique. And then you're garnishing with a fresh basil leaf. Fun bartender trick. Slap the leaf between the palms of your hand before you lay it on top of the cocktail. What that does gets the aroma to come right up at us, and when we lift the drink to take a sip, that basil flavor is so fragrant and so, so awesome. So that's Hollywood and Vine. Great bourbon cocktail. Definitely try it with your friends the next time you're hosting happy hour. And then for my second option, I mentioned we're doing a zero proof cocktail. So I'm just gonna rinse out my shaker here. Now, the biggest thing I wanna say about zero proof or a mocktail is it doesn't need to be boring. I feel like a lot of times when we have friends who, for whatever reason, can't imbibe alcohol, it's a lifestyle choice, it's a health choice, whatever that may be, it doesn't just need to be like seltzer with lime. There's so many other cool options that we can do. With that in mind, what I'm doing today, I'm gonna use the same honey syrup that I made. So now that's in your cocktail wheelhouse and you know how to use it, which is great. I'm using some fresh peaches, and then I'm using Serrano chili. I love Serrano because Serrano is actually slightly different flavor profile than jalapeno. It's a little bit spicier, really, really green in flavor. If you can't find it at your local store, jalapeno will totally work. But again, in this case, I was partial to the Serrano chilies. Then I'm also doing some fresh lemon juice, again, that I pressed, but if you need to buy it in advance, totally fine. You're gonna need a little club soda as well to finish it off. So it's a spicy, kind of sweet, summery mocktail that I'm making. So to get started, I'm gonna do about 3 to 4 slices of my fresh peach that I sliced in advance. Again, make sure it's pretty ripe because you're actually hoping to get some juice out of it. And then I'm gonna throw in 3 slices of my Serrano chili. Again, I like heat. If you don't, you can leave out the spice, play with the proportions. I say kind of go for it and see what you think. It's actually really, really good and well balanced. So I put my peach and my chilies in the bottom of my shaker. That's where I wanna start. And then we're using that honey syrup again, like I said, but I'm using 3/4 of an ounce this time. The reason being that I'm gonna use a whole ounce of lemon juice, so I don't want the drink to feel overly tart. So again, always with mixology, we're looking for that perfect balance, well, as perfect as we can get, right? So you'll need a muddler. Muddler is just kind of that wooden or metal tool with some little teeth on the end. There's other things that you can use. You can look for like a wooden spoon in your house would be totally fine. The action you want to do when you're muddling, you're driving the muddler down and twisting. And basically what I'm doing is I'm releasing all the juice from the peaches, and I'm mixing in the heat from the chili and getting the honey incorporated. And that, my peaches were so ripe because, again, this is the perfect time of the year for them. So it's actually looking exactly the way I want it to, which is always a good thing. So then I have my fresh lemon juice. I'm gonna go ahead and do a whole ounce of this, like I mentioned. So think about when you make lemonade, if you make homemade lemonade, maybe you had a lemonade stand as a kid. I know I did. So yeah, you're always like mixing kind of equal parts of the lemon and the sugar. So think about that when you're doing your cocktails as well. So now that I have that in my shaker, again, we're gonna add our ice. Also, just a quick like little primer on tools. If you're not a big home bartender and you don't have a cocktail shaker, that's totally okay. I'm going to tell you something that works really well is a glass mason jar where you screw on the lid, like the kind that you would put pickles in. It's actually a great cocktail shaker and really, really easy to find. You could even reuse like a jam jar or something like that. So that's something to think about if you don't have all the fancy bar tools. Really going for it with our shaking. For this cocktail, zero proof cocktail, I am using a short glass, what we call a rocks glass. Just a different presentation. I actually want to add ice to it, so that's why I'm serving it that way. And again, it's always going to be good, actually, and I'm reminding myself, to double strain. Because again, we have a lot of texture in there from the peach, from the chili. So I get my mesh strainer once more, double strain through that. And this is a slightly thicker consistency, so you're really gonna need to tap the side of the shaker. And it's gonna take you a little bit of time to work it through. All the fun sounds of bartending. Perfect. And that's looking the way I want it to. So then I am going to add ice. And you'll see, I'm going to show you right here, it's coming up not quite to the top of the glass. And this is where my seltzer comes in. So I'm finishing the drink with a generous splash of seltzer. And then I'm getting all the way to the top there. For my garnish, I am going to do a slice of fresh peach. And just because, why not, for good measure, we might as well make it fun. We're going to throw another slice of the serrano chili on there. And this one I've called To Be or Not to Be. It's kind of a fun name. It's incorporating the honey syrup again, so I like that. It's creative to come up with something different every time. So again, that's a really great mocktail. You could also, if you like that recipe and you're interested in making it a traditional cocktail, I would suggest trying that and adding a little tequila. Tequila would be lovely in it, rum would be lovely in it. So there's some flexibility there with what you can do. It's been awesome seeing all of you virtually today for happy hour. I hope you try these cocktails. I hope you enjoy making them. Again, I'm Natasha Soto Albors. You can find me on Instagram at Violet and Vine of NY. I'm always happy to answer cocktail questions. If you send me a message, you could take a picture of your home bar and I might give you advice on what you could make based on the bottles you have on hand. So I look forward to seeing you hopefully soon in the future. Cheers and have a wonderful evening.
Thank you so much, everyone, for joining us. Have a great rest of your day.